Endoscopic mucosal resection is a safe and effective treatment for large colorectal, sessile or laterally spreading lesions greater than 20 mm in size. The procedure has morbidity and mortality advantages over surgery, and as it is performed as an outpatient procedure in most cases, it is also substantially more cost-effective. However, certain anatomical locations may create distinctive difficulties for endoscopic treatment. Lesions involving the anorectal junction, appendiceal orifice, or ileocecal valve pose unique site-specific challenges to technical success and require an accordingly modified and tailored approach. With conventional techniques, therapeutic efficacy cannot be assumed. Laterally spreading lesions involving the ileocecal valve represent a small proportion of the overall colonic laterally spreading lesions burden. Traditionally, these lesions tend to be referred for surgical management without involvement of a tertiary endoscopy service because of perceived concerns in relation to resection complexity, safety, and effectiveness. Production pressure in a busy endoscopy service may also influence management decisions for difficult lesions. There is a paucity of data on endoscopic management of laterally spreading lesions of the ileocecal valve to guide an adequate clinical approach. Therefore, Nanda et al. Evaluated the applicability, safety, and effectiveness of endoscopic mucosal resection for laterally spreading lesions involving the ileocecal valve in a tertiary referral setting. They report their findings in their study entitled Endoscopic Mucosal Resection of Laterally Spreading Lesions Involving the Ileocecal Valve, Technique, Risk Factors for Failure, and Outcomes. Here is a summary of their findings. Background and study aims. Endoscopic mucosal resection of laterally spreading lesions involving the ileocecal valve is technically demanding. Conventionally, these lesions are considered too challenging for endoscopic therapy and are primarily managed surgically. The aims of the study were to describe the effectiveness, safety, and outcomes following endoscopic mucosal resection of laterally spreading lesions at the ileocecal valve. Patients and methods. This was a single-center, prospective, observational cohort study performed at an academic tertiary referral center. Patients undergoing endoscopic mucosal resection for laterally spreading lesions larger than 20 mm in size involving the ileocecal valve were recruited over a 5-year period. Standard or cap-assisted colonoscopy with inject and resect endoscopic mucosal resection technique was performed with standardized post-endoscopic mucosal resection management. Procedural success, safety, and outcomes compared with non-ileocecal valve laterally spreading lesions managed during the same period were analyzed. Results. A total of 53 patients with ileocecal valve laterally spreading lesions were referred for endoscopic mucosal resection. Median age 69 years, median lesion size 35 mm, 52.8% were females. 6 patients went directly to surgery because of an endoscopic diagnosis of malignancy or technical failure of endoscopic mucosal resection. EMR achieved complete adenoma clearance in 44 out of 47 attempted cases. Surgery was ultimately avoided in 43 out of 53 patients. Complications included bleeding in 6.4%. There were no perforations or strictures. Early adenoma recurrence was detected in 7 out of 40 patients, and 1 out of 22 patients had late recurrence. All were successfully managed endoscopically. Factors associated with failure of ileocecal valve endoscopic mucosal resection were ileal infiltration and involvement of both ileocecal valve lips. Conclusions. In the majority of cases, laterally spreading lesions involving the ileocecal valve can be effectively treated by endoscopic mucosal resection on an outpatient basis. In specialized centers, complications are infrequent and more than 80% of patients ultimately avoid surgery.